Hey Nancy Kate, I'm Sarah. I'm going to be performing a physical exam on you today. So first, I'm going to start with a general survey. I'm going to assess your overall appearance, your level of consciousness, emotional state, if you look like you're in any distress or pain, and then your overall health and hygiene. So that completes the general survey. Now we're going to move on to the vital signs. So first I'm going to start with blood pressure. So I'm going to go ahead and make sure your legs are uncrossed. That's perfect. And then put this around your arm. Make sure it's nice and tight. Okay. Right. And let's try that. A little tighter. Okay. Let's try that. Make sure that's lined up good. Put my stethoscope on. And bells on. Good. Thank you. Hold on. Make sure that's all the way tight. Okay, 114/72. Sorry, that took me a second. Okay, that's perfect. So now I got blood pressure check. Now I'm going to assess your heart rate and respiration rate. So, okay, perfect. So your heart rate was about a 72, and so now I'm going to check your respiration rate. Just watching chest move up and down. And that's about 14. And then at this time, I would also check your temperature and your oxygen saturation. We don't have that equipment. And then what's your height and weight?
135, 5'5".
Okay, perfect. And then I would use that to calculate your BMI. Okay, so that completes the vital sign portion of the exam. So now we're going to move on to the skin portion of the exam. So first I would just take a look at your skin, and I'm just going to assess the color, any changes in color I see, looking for any moles or lesions anywhere on the skin. And then after completing that, I would take my hands, using the back of my hands, I'm going to run my hands down the front and back of your arms bilaterally, assessing for any changes in temperature, texture, or moisture. And then you could just go ahead and stand up. So if it was in the line, then assessing the back, temperature, texture, and moisture. And then same thing on the front, temperature, texture, and moisture. And then I'm making sure to check between the toes and the fingers for any of those abnormal color changes or moles or lesions, and same thing. I'll check the bottoms of the feet too, make sure they're not seeing anything. Okay, so back, and checking for the stomach and everywhere, and then also on the back too, making sure I don't see anything in the back area either, any new moles, skins, lesions, or anything like that. Perfect, okay. So now that completes the skin portion of the exam. So now we're going to move on to the hair portion. So I'm going to assess the scalp and hairline and near the ears too, looking to see if I see any abnormalities. And then I'm looking at the distribution, quantity. I'm just going to go ahead and actually take your hair out so I can look at that. Distribution, quantity, and texture of the hair. looking at all the different areas, looking for any abnormalities. Okay, perfect. And then, go ahead and get that back to you. And then after doing so that completes the hair portion of the exam. Now I'm moving on to the nail portion. So first I'm just going to look at your nails. Looking at any abnormalities I see just looking at them. Then I'm going to feel for any abnormalities. Looking at the toes too, all that. And then, I'm going to perform the capillary refill. Also capillary refill. And I forgot to, your nails are painted so I can't see it. Okay, and then I forgot turgor on the back to the skin portion of the exam. So I'm just going to pinch and just checking for your hydration. So skin, hair, nails. Now we're going to move on to the head portion of the exam. So I'm going to check the head for any abnormalities, just the overall shape. Looking at that, I don't see anything, any protrusions, bony protrusions. Now I'm going to assess the frontal sinus, maxillary sinus, parotid gland, and temporal arteries, feeling for any abnormalities, and just let me know if any of that hurts. It's all good? Okay, perfect. That completes the head portion of the exam. Now I'm going to be moving on to the eye portion of the exam. So let me make sure I got all my stuff set up. Okay, so for the eye portion of the exam, first I'm going to assess the external appearance of your eye, looking for any abnormalities I see. Then I'm going to assess the internal appearance of your eye, so looking in, looking for any abnormalities there. Perfect. Okay, then I'm going to assess your pupillary size. First I'm going to check it just looking in the normal light. So if they look straight ahead at me, awesome. Good. And then I'm going to check it using the light. So let me check. So look straight ahead at me. It's going to be bright. Good. And then, good. Okay, perfect. So I checked the pupillary size. Now I'm going to move on to the light reaction test. Checking direct and consensual response. And so if you could just look right over my shoulder. Good. Now over here. Good. Now I'm going to check the near reaction test. So this one, I'm just going to get you to look at my finger, then look at the wall, and then look back at my finger, okay? So look at my finger, look at that wall, look at my finger, look at the wall. Okay, perfect. Now we're going to do, so we did external, internal, pupillary size, light reaction, near accommodation. So now we're going to do corneal light reflex test. So if you could just look straight at me, I'm just going to assess. I'm just going to shine this light in your eye real quick. Okay, good. Now we're going to test the extraocular muscles with convergence. And so I'm just going to get you to keep your head still, look at me, and you just follow my finger with your eyes, okay? Okay, ready? Good. Keep going. Good. Keep going. Boop. Okay. Okay, now we've tested that, so now we're going to go ahead and test your visual acuity. Do you wear contacts or glasses?
Yes.
Do you wear contacts? Okay, perfect. So, so this says hold this card at about 14 inches. So I'm actually just going to get you to hold it about 14 inches. And let's do both eyes uncovered first. So can you tell me the smallest, let's do the smallest numbers you can read.
9, 5, 6, 2, 3.
Okay, now cover up your right eye. Same thing, read that line backwards, or the smallest line backwards.
2, 3, 6, 5, 9.
Okay, and now cover up the other eye, same thing.
2, 3, 6, 5, 9.
Okay, perfect. Okay, so now we're going to test your visual fields now. And so for this one, I'm going to hold numbers in different quadrants, and you're going to tell me what they are. But first, I need you to cover up your right eye. I'm going to cover up my left eye. And you're still just going to move, you're going to look straight ahead. So you're not going to move your head or eye when I'm doing this, okay?
Okay.
So let's do
2, 1, 2.
Sorry.
3.
Okay, now cover up the other eye, same thing. And
2, 1, 3, 2.
Okay, perfect. So now we've done visual fields, and now let's go ahead and make sure I'm just making sure I get everything. Let's go ahead and do the ophthalmic exam. Okay. Okay, perfect. I'm gonna go ahead and dim the lights for this one too.
Okay.
Okay. Okay, perfect. And you can just look straight ahead now. I'm just going to check the red reaction. Good.
Come a little. I just don't want you to be on the video for that.
Yeah. Sorry. Okay. Now, so I would just check your red
Maybe do it
reflex.
from over here.
Okay.
That's better.
Okay, yeah, that's better. Okay. Good. Checking your red reflex. Now I'm just going to move in. I might touch my hand on you, so. Okay, awesome. That looks awesome. I can actually see something. Okay. Now same thing over here, just like straight ahead. Good. That's awesome. Okay, same thing. Gosh. Okay, perfect. Okay, so that completes the eye portion of the exam. Now we're going to move on to ears. Let me put back on the light. Okay, so the ear portion of the exam. First off, I'm just going to check the external appearance of your ears, both of them, making note of any abnormalities. And then I'm going to touch around the ear in some different areas, the tragus, auricle, mastoid process. If you feel any pain anytime I'm touching anywhere. There we go. Okay, now I'm going to perform the tug test on the ear. So just let me know if you feel any pain. All good? And then over here. All good. Okay, perfect. And now I'm going to perform the whisper test. So this one, I'm just going to stand behind you and whisper a series of letters and numbers, and you just repeat back what you hear, okay?
2B3.
Perfect. And now, can you occlude one of your ears too? Good. And now, same thing.
F45.
Okay, now occlude the other one.
28B.
Perfect. Okay, so now that I'm going to take a look inside your ears. So, making sure, yeah, that's great. Okay. And I'm going to also touch with my your ear and around here, okay? Yeah, that's perfect. Okay, now I'm going to go ahead and do the other ear too. Looking to see if I see any abnormalities in the inside of your ear. Okay, perfect. All looks good there. So that completes the ear portion. Now we're going to move on to the nose. I'm just going to assess the external appearance of your nose, looking at any abnormalities, anything I see. And now I'm going to do the nasal patency test. So if you could just occlude one of your nostrils and breathe in like normal. Perfect. Now occlude the other one. Breathe in like normal. Okay. And now let's go ahead and do the rhinoscopic exam. So this one, I'm just going to look at the inside of your nose. Same kind of thing with the ear and eye. Good. So I'm going to look up. Good. Now same thing over here. I know, sorry. Last time I did this one. Good. That's awesome. Okay, so that completes the nose portion of the exam. Okay, so now we're going to do So we did eyes, ears, nose. Now we're gonna do, sorry. You're really upset. Now we're gonna do the mouth portion of the exam. So I'm just gonna assess the external appearance of your mouth, and if you could open your mouth. And I'm looking at mucosa, lips, posterior pharynx, teeth, all that, gums, making sure everything looks healthy. Now, if you could lift up your tongue, I'm looking under your tongue to see if I see anything. And I'm assessing your posterior pharynx. If you could say, ah.
Ah.
Good. And now I'm checking if you could stick out your tongue. And I'm checking for that too. Good. That's perfect. Now, so that completes the mouth portion of the exam. Now we're going to move on to the neck portion. So first off, I'm just going to assess the external appearance of your neck, looking for any abnormalities I see. Then I'm going to palpate the musculature, your trachea, all of that, great vessels, anything like that. Feeling for any abnormalities. And then I'm going to reach around you real quick. This one's a little weird, but I'm just going to check your thyroid real quick. I'm just going to put my hands around your neck. And then I want you to just swallow for me. Good, that's perfect. Okay, and now I'm going to palpate some lymph nodes, and I just want you to tell me if you feel any pain, okay? So first, submental, submandibular, tonsillar, preauricular, postauricular, occipital, superficial, superficial cervical, posterior cervical, deep cervical chain, supraclavicular. Okay, so all that looks good, no pain, awesome. Okay, now we're going to move on to the lung portion of the exam, lung and thorax portion of the exam. So first, I'm noting your color, making sure I don't see any signs of hypoxemia, cyanosis, anything like that. Looks good. I already assessed it. I already assessed your respiratory rate, your depth and level of breathing earlier in the exam during the vital signs. So now I'm looking at your chest shape contour. I'm looking at your chest wall movements, making sure I don't see anything abnormal. All looks good. So now I'm going to perform the posterior portion of this exam. So if you could, yes, keep your legs out, and then I want you to, yeah, that's good. If you could just cross your arms for me. Awesome. And so I'm just going to palpate 4 areas, or 4, I guess, on each side of your back, and I just want you to tell me if you feel any pain, okay?
Okay.
Good. 2. And just get under there. No pain?
Nope.
Okay. Now, if you could just take one big, deep breath in and out. Good. Testing one more time. Testing the chest wall expansion. That's good. Okay. Now I'm going to place my hands on your back in that same kind of pattern. And if you could just say toy boat every single time you feel my hands, okay?
Toy boat, toy boat, toy boat, toy boat.
Okay, perfect. Now I'm going to just tap on your back in a couple different places, and so you just continue to breathe like normal for this one. One more time up here. Okay. Perfect. Now I'm going to place my stethoscope on your back in a couple different locations. Whenever you feel my stethoscope, I just want you to take a deep breath in and out with your mouth open, okay?
Okay.
Ready? Perfect. Awesome. Now that completes the posterior part. Now I'm going to move on to the anterior portion of the exam. So it's going to kind of follow the same pattern. So first I'm just going to feel some areas of your chest and just let me know if you feel any pain, okay? Good. 3 areas. Now, same thing, take a deep breath. Good, that's perfect. Okay, now I'm just going to, anytime you feel my hands again, I want you to say toy boat, toy boat, toy boat, okay?
Okay. Toy boat. Toy.
Yeah, let me do one right here, sorry.
Toy boat. Toy boat.
Okay, perfect. Now I'm going to tap just in a couple, 6 different areas on your chest again. So. Get right here. Sorry. You're good. And then wait, one more over here. Good. You can still see me. Okay, now same thing. I'm going to auscultate in the same areas, and so when you feel my stethoscope, or see it, I guess, just take a deep breath, okay?
Sorry.
I put it in the wrong way, so that's why I can't hear anything. Okay, ready? Oh, and since I'm doing the apex, I want to do the bell. That's perfect. Now switching to the diaphragm. Okay, perfect. Okay, so now that completes the lung and thorax portion of the exam. So now we're going to move on to cardiovascular. Okay, so first off, I already noted your color and all of that earlier. I already noted your depth and effort of breathing earlier too, and if you were in any level of distress. So that's all checks out. I'm going to make sure, also this would be the time that I would assess the vitals again if I need to. Saw anything abnormal, I do that now. But now I'm going to make sure you're at a 30 or 45 degree angle. So let's say, I don't know, that's good.
I think that's good.
That's good. That's perfect. Okay, so make sure that the patient was at a 30, 45 degree angle. So now I'm going to assess the JVP of the right side. The JVP of the right side. So I'm going to make sure my patient turns their head towards their left. Good. I'm just going to look at, let me grab some things real quick over here. Let's bring this over here. Yeah. That's perfect. Okay, so I'm going to, make sure my patient turns to the left. That's perfect. I'm going to take my pen light. I'm going to look for the pulsations of the JVP. Okay, good. And then I'm going to note where it stops. Okay, that's good. Okay. And then I'm going to make a note of where it stops. Good. Know where I can no longer see a pulsation. And then I'm going to measure that. I'm going to take it from the sternal angle. And take a straight edge and a ruler. And I'm going to measure that. Sorry. It's kind of hard to. And it's about 2 centimeters, so that's a normal range. Good, perfect. Now I'm going to move on to the carotid portion of the cardiovascular exam. So I'm going to assess your pulses of the carotid artery, making sure I see the pulsations. And then first, before I palpate anything, I'm going to make sure I auscultate, listening for any bruits. I'm going to use both the bell and the diaphragm for this. Why do I keep doing that wrong? Okay. Okay. Okay, so I don't sense any buoy, so I'm good to palpate. So I'm going to palpate the carotid arteries one at a time, noting for any the amplitude and for any thrills. Good. Awesome. So carotid looks good. Now I'm going to move on to the precordium portion of the exam. So I'm going to assess the anterior chest, making sure I don't see any abnormalities. And then I'm going to check for the heaves using the base of my hand and the 5 cardiac areas. So. Come up here. 1, 2, 3. And then am I over here? Same thing with my fingertips. I'm going to check for thrills. Okay, now after that I'm going to assess the PMI. So I'm going to start with my palm and then rule in, single into my fingertip. I'm checking for location, diameter, duration, and amplitude. So those were things. So let me see. Okay, so I narrowed it in to my fingertip. Good. Now I'm going to auscultate those 5 cardiac regions, listening for any abnormal heart sounds or extra heartbeat such as S4, S3, friction rub, and gallop. And I'm going to, for this, use my bell and my diaphragm. Okay. Same thing with the bell. 1, 2, 3, 4. Okay, good. Everything looks normal there. So now we're going to move on to the peripheral, or the peripheral vascular portion of the exam. So for this one, I'm going to, I kind of already did this with the skin portion of the exam, but I'm checking again. If you actually go ahead and sit up for me, or just, this is good. So I'm just assessing the upper extremity and lower extremity, noting for changes in color, warmth, or ulcerations anywhere, especially the medial ankle anywhere. And then if you could stand up for me, I'm just going to check your back too. On the extremities, good, good, good. Okay, now if you could go ahead and have a seat again, good. Okay, so now I am going to assess the pulses of your upper extremity. So I already did the radial pulse earlier in the exam, and I also did the capillary refill, so I just need to check your ulnar and your brachial. So I did this. I'm just going to check your ulnar and radial again. Let's make sure I feel both. Good. And good. Now I'll check the lower extremity pulses. So first I would assess your femoral, but we won't do that today. Then I'll assess your popliteal. So you could scoot up a little bit. There we go. Good. Then your posterior tibial, right there, and then your dorsalis pedis. There you go. Hold on. Okay, perfect. Then I would assess your lower extremity for any signs of edema. So I check your shins, your medial ankle, bilaterally, good. And then also dorsum of your foot bilaterally. And also for the pulses, I just did unilaterally for the pulses, but I would assess bilaterally for all the pulses. And so that completes the peripheral vascular portion of the exam. So now we're going to move on to the abdominal portion of the exam. Sorry, it's a bug. So first I would assess or note the skin appearance. Oh, first off, actually, if you could go ahead and lean back. I'm going to practice proper draping technique. So, yeah, if you could do that. Good. We have another blanket. And then, good. Tuck. Good. All right. So, I'm assessing the overall appearance of your abdomen area, looking for your skin appearance, the symmetry of it, shape, contour, if I notice any movements. All looks good. And for the abdominal portion of the exam, before I palpate or percuss or anything, I'm going to need to auscultate. And there it is. So I'm going to auscultate all 4 quadrants of the abdomen. I'm going to auscultate for 30 seconds, or unless I hear bowel sounds, and then I know don't have to do 30 seconds. And for this, I just use a diaphragm. Good. Awesome. Good. Okay, and so now I've auscultated all 4 areas, and then I would also auscultate the vasculature in the abdominal area. So that's going to be, and I'll use the bell and diaphragm for this one. So first I'm going to check the abdominal aorta, then the renal arteries, then the iliac arteries, and then I would also check the femoral arteries using the same technique. So, and then doing the same thing with the bell. Abdominal aorta, renal, iliac, femoral, or I would check femoral. Okay, so after I've auscultated all of the areas, I'm now going to percuss in all 4 quadrants of the abdomen, making note of dullness and tympany throughout it. Okay, perfect. Now I'm going to palpate to assess your liver, how big the liver is. And so first I'm going to take this pen. Good. And I'm going to percuss. First off, I'm going to percuss up until I hear dullness. Good. You can hear dullness there. And mark. And then I'm going to percuss down now until I hear dullness again. And then I will measure the size of the liver. Perfect. Awesome. Okay, so now I finished the percussion portion of the exam, or this part of the exam. So now I'm going to move on to what's the word? Palpating. Okay. So first, if the patient was in any sort of pain or distress, I would definitely palpate that portion last. So I'm going to, and I'm also going to make sure I note if the patient's any distress or anything when I'm palpating. But first I'm going to palpate each of the 4 quadrants lightly. So good. Perfect. Then I'm going to palpate each of the sections deeply. So assessing for any masses. And with lightweight, I was assessing for rigidity or anything like that, or if the patient was guarded or anything like that. So now we use 2 hands for palpating deeply. Good. Perfect. Good. Now after that, I'm going to, also I would palpate any areas concerned, sorry. The draping is moving.
No, I was trying to help you.
No, you're good. Now I'm going to palpate, if I felt any hernias or extra masses, I would palpate those more too. Now I'm going to palpate the liver and define the surface of the liver. So I'm going to come over here, do like a hooking technique. And so I'm just going to feel it first. I'm going to ask the patient to take a deep breath in. I'm going to push back. Good. Okay, perfect. Okay, so now after I palpate that, good. Now I'm going to palpate and estimate the measurement of the abdominal aorta. So, okay. Okay, good. Okay, so now that completes the abdominal exam. Now finally, we're going to move on to the MSK portion of the exam. So we can go ahead and remove the drape. Woohoo! Now the MSK part. Yeah, good. There we go. Oh yeah. Yay. Good, 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 good. We're good. Perfect. So first things first, I'm going to assess the TMJ. So I'm looking at the TMJ. I'm looking for any erythema, swelling, any other abnormalities, deformities, anything like that. Not seeing any of that. So now I'm going to palpate TMJ, also the temporalis muscle, those muscles of mastication. And now I'm just going to get you to do a couple movements. If you could open and close your mouth. Good. Now stick out your teeth, and then now pull back, retraction, and then lateral protrusion, moving it back and forth. Good, perfect. And that performs the TMJ. So now we're going to do the spine. So I'm going to assess your spine from the side, posterior. Now we could lean forward. I'm assessing all this. Your posture, curvature, any abnormalities I see. And then now I'm going to palpate your spine, feeling for any abnormalities, any protrusions, anything like that, and then also your SI joint. Feeling for any abnormalities. Good. Perfect. Good. Then now we're going to check the range of motion for your neck first. So if you could just go like this. Go like this, backwards now. Now lateral flexion, side to side. Now lateral rotation, go like this. Good. Now for the lumbar spine. So first you're going to lean forward, lean back, kind of go run your fingers down your back, and now go side to side. Now for rotation, keep your hips still, and I want you to rotate like this. That's good. 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 All good? Okay, and now that completes the spine portion. And so now we're going to move on to the shoulder. And from here on, I'm going to be assessing the active range of motion in these different joints, but I would also, I'll assess bilaterally, but I would also assess passive bilaterally too. So first off, let's do the shoulder. So I'm inspecting the shoulder, looking for any abnormalities I see. Good. And then I'm going to palpate the shoulder, all the joints, the scapula, acromion, coracoid process, all that good stuff, looking for any abnormalities. And now we're going to do range of motion. So you can follow me. Let's do, lift your arms up like this. Good. Flexion, extension. Good. Now go like this. A abduction, a deduction. Yeah. And then let's do lateral, internal or external rotation, internal rotation. Good. So your shoulder looks great. Now let's do the elbow. So looking at your elbows, inspecting them first, no abnormalities. No abnormalities. Yeah, okay. Now I'm palpating it, feeling for any abnormalities, feeling all those joints. Good stuff. everything looks good. And now let's do bilateral. And again, I would do passive for this one though too. So flexion, extension, and then pronation, supination, pronation, supination. Good. Okay, perfect. So that checks out for the elbow. Now we're going to do the wrist and hands portion of the exam. So inspecting your wrist and hands, looking for any abnormalities. Nothing. Okay, now feeling, palpating for any abnormalities. Everything looks good. Okay, so now we're going to do the wrist. So good. Flexion, extension, ulnar deviation, radial deviation. Good. Everything looks good. Now we're going to do the fingers. So flexion, extension. Everything looks good. Now abduction, adduction. Now the good old thumb. Can you go like, so go like this, go like this, go like this, go like this, and then go like this. So that was, for the thumb, that was flexion, extension, abduction, adduction, and opposition. So now we are done with the wrist and hands. And so now we're going to move on to the hips. So you can take a couple steps. Good. Moving, I'm assessing your gait. I'm assessing overall appearance of the hips. No abnormalities, anything like that. Good. Gait looks good. Now I'm going to palpate the anterior and posterior parts of the hip. Feeling all of those joints and stuff. Making sure I don't feel anything abnormal. All looks good. Okay, so now we're going to do some good old dancing real quick. So first, if you could just kick your leg out. Good. Kick your leg back. Good. Now I want you to kick your leg to the side. Kick your leg back in. Yeah. Or you could just, yeah. And then now I want you to pick your leg up. Go like this. Oh, I felt my knee pop. And then go like this. Good. Okay. So that was flexion, extension, abduction, adduction, and internal and external rotation of the hip. So now we're going to do the knee. So I'm assessing the knee, inspecting it, making sure I don't see anything abnormal, erythema, swelling, deformities, anything like that. Everything looks amazing. Now I'm going to, now I would bilaterally inspect all these, the midline landmarks, lateral landmarks, and medial landmarks of the knee, assessing for or feeling for any abnormalities. I would do that bilaterally. And now for range of motions of the knee, flexion, extension, flexion, extension, flexion, extension. Now you can just go ahead and do the other one too. Good. And again, I would assess passively too, bilaterally. Now, knee, ankle. You can go ahead and sit for this one. So the ankle one, I'm assessing the ankle, looking for any abnormalities. Again, inspecting it. Now I'm palpating it, Achilles tendon 2 all the way back here. All the joints, calcaneus, all that good stuff, assessing for any abnormalities. Good, palpating, don't feel anything. Low rosy. Now, if you could, looking at the toes too, good, no abnormalities. Now, if you could point your toes, so dorsiflexion, plantar flexion, good, dorsi, plantar. Now, move your, try to, I don't know, you can stand up for this one. Because you got to move your ankle like inversion and eversion. Good. Good. Both things. Do that other one too. So she's moving inversion, eversion. And then now for the toes, if you could do flexion and extension of the toes. And flexion and extension of the toes. All right. And that completes everything for MSK and for the whole exam. Thank you and good night.